Hello, my name is Kevin Shiver. I'm the wound care provider here at Medical Center Barber. Today we're going to give a brief overview on what we do here at the Wound Care Center and what a chronic wound is. Starting off with a chronic wound. What is a chronic wound? Chronic wound is a wound that does not heal in a normal set of stages, in a predicted amount of time. Basically, it does not heal like normal wounds heal. Chronic wounds oftentimes remain in the inflammatory stage. And that's where we come in. That's where advanced wound care comes into play. For whatever reason, the wound is not healing. That's where we come in to diagnose the reason. Most wounds are vascular or diabetic pressure. Some wounds could be from radiated tissue. The patient may have had cancer and a wound develops in a place that they had radiation. This tissue here is damaged, the vessels are damaged, that they can't get blood or proper oxygen. Vascular ulcers are arterial or venous. Arterial ulcers result from blockages in the artery, and given this, blood and oxygen cannot get to the wound, cannot get to the tissue itself. In this case, we figure out how severe the disease is, and it's called peripheral vascular disease. We will consult a vascular surgeon for possible intervention to help restore blood flow to that area, promoting wound healing. The other vascular ulcer is venostasis ulcer. This is where the veins, and most of the time it's in the lower extremity, the veins don't work properly. The valves in the vein cannot open and close like they should, and given that, blood will pool in this area. The pooling of the blood and fluid causes leg swelling, edema, and increased pressure. This increased pressure around the tissue or in the tissue around the wound prevents blood and oxygen to get to the wound for proper healing. Pressure ulcers are another type of wound, usually occurring in the elderly or in those who are immobile. These patients are often have poor nutritional status. Sometimes they are dependent on being fed by others. The elderly can have several comorbidities, including peripheral vascular disease or diabetes, along with poor nutrition, which all play a big role in preventing wounds to heal properly.